Go.
Good evening, Dr. Eckstone, classmates, and guests. Thank you for coming out on this bone-chilling night as I share with you my viewpoints on chronic disease. With this presentation, I want to make you aware of what chronic diseases are and how to prevent them, because 70% of all deaths in the United States are due to chronic diseases. What is chronic disease? There are two different types of disease that people can suffer from: acute and chronic. Acute disease come on fast with mild to severe symptoms that last a certain amount of time. In some cases, they can be life-threatening. Chronic diseases, on the other hand, take place over time. They too can be either mild or severe, but it takes a lot longer for them to develop and it takes longer for them to disappear. The symptoms also have a tendency to come and go repeatedly. Chronic disease is a long-lasting condition that can be controlled but not cured. Chronic disease affects the population worldwide. As described by the Centers for Disease Control, chronic disease is a leading cause of death and disability in the United States. There are 1.7 million deaths each year because of chronic disease. Data from the World Health Organization show that chronic disease is also the major cause of premature death around the world, even in places where infectious diseases are rampant. Although chronic diseases are among the most common and costly health problems, they are also among the most preventable and most can be effectively controlled. What causes chronic diseases? Well, it could be lack of physical activity, tobacco use, not consuming enough fruits and vegetables, and drinking too much alcohol. Those are all common causes of chronic disease. Heart disease, cancer, diabetes, and stroke are the most common types of chronic disease. When it comes to avoiding chronic disease, I will speak on 6 preventive measures that can be taken. Number 1, do not smoke. According to the American Heart Association, approximately 26.2 million men and 20.9 million women smoke in the United States. Smoking increases your risk of heart disease, emphysema, and lung cancer. To prevent the onset of these diseases, do not smoke or quit if you currently do. Number 2, get some exercise. Exercise brings with it a number of benefits. It helps reduce weight, improves mobility, elevates mood, strengthens bones, and helps improve circulation. All of these factors will help reduce the chances of developing diabetes, heart disease, and arthritis. Aim for 30 minutes of moderate exercise on 5 or more days a week. Number 3, reduce your alcohol intake. Drinking excessive amounts of alcohol can cause a number of health problems. A chronic condition that can occur is cirrhosis of the liver. This is a chronic condition where scar tissue replaces healthy tissue, causing the liver to not function optimally. To prevent this disease, keep your alcohol intake moderate. Number 4, cut out unhealthy foods. What you eat plays a big role in developing chronic diseases. Foods that are processed have large amounts of refined sugar and are high in saturated fats should be avoided. They can cause obesity, high blood pressure, high cholesterol, and diabetes. Number 5, eat plenty of fiber. Fiber is a non-digestible substance that gets passed through the digestive system. Eating fiber helps relieve constipation and it reduces your chances for colon cancer, digestive disorders, diabetes, and kidney stones. The Institute of Medicine recommends eating 14 grams of fiber for every 1,000 calories you eat. Some examples of fiber-rich foods are fruit, vegetables, whole grains, beans, and oat bran. Number 6, do not sleep around. Having sex with multiple partners can increase your risk of contracting a sexually transmitted disease, many of which are chronic conditions. If you do have more than one sex partner, make sure to use condoms and practice safer sex. Now that we know what chronic disease is and how to prevent it, we are coming to the close of this presentation. Again, chronic disease is preventable by choosing a healthy lifestyle. If you have a chronic disease, it can be controlled. Thank you, and have a good night.